All right, Graham, what was your first thoughts when you heard about RM?
Well, I guess I didn't know anything about it. So I'd spoken to a few people that was on one of our business courses, a few physios that had done level 1, and they were really impressed. And I looked it up and Googled it and got onto Michael's website and had a look at some of the case studies, and I just thought, that's pretty weird stuff, but I could see how it could work, and I think I've been more open to examining, the whole musculoskeletal system, for areas that may be contributing to a particular, pathology or symptoms. So I was open to that, but I just didn't have a sort of a real methodology to approach it. I just didn't have the skills, and so I thought this could be something that would help.
Yeah, so you've already got a successful practice down in Melbourne.
Why, thank you.
Yeah. Is there one key area that made you want to explore RM further?
There's so many people that you help with sort of in the traditional model of physio, but there's other people that seem to be having a mechanical problem, but you just can't get to the bottom of it. And so there's more out there, and I guess I was starting to get a little bit recipe based in my treatment. I wasn't really enjoying that. I wasn't finding work that fulfilling. Yeah, probably just the results. The fact that you could get better results and feel more confident that you were really evaluating somebody's musculoskeletal system.
Yeah. Now you're about a year into the RM process. Have you noticed any changes that you have with your clients' results?
Yeah.
What big changes have you had with your treatment techniques? Or
yeah, I think probably results has been fantastic. I've had people get vast improvements from treating areas that I wouldn't have picked up before. Just wouldn't have. It's all on our website, mind you. We've put some blogs of the cases, more remarkable cases. Like a lady with tennis elbow, and she got 90% improvement in one session from a hamstring release, or another chap that had right leg pain, sort of anterior thigh leg pain, only at night when he slept on his right side, and he'd seen lots of people, chiros, etc., and he improved considerably to the point where he was not getting pain at night. Basically, he could sleep through the night. He wasn't sleeping basically because of his pain waking him up, and that was from a subscap release. So I wouldn't have gone there before. I wouldn't have known. I would have worked on the lumbar spine a little bit. Maybe thoracic, but I wouldn't have explored anything else. So I think it's changed. It's changed my outlook a lot, and I think more recently, just in my level of communication with people, being quite specific about what I'm saying, and the whole idea about looking for asterisk signs, and they're the measures of of clinical improvement. I'm more confident with that now, and I feel more confident as a physio. So yeah, it's helped in a lot of ways.
Yeah, so you've noticed quite a lot of changes with clients. Have you noticed any change with your business, how you run your business and your outlook?
Actually, for the last few weeks, I've pretty much been booked out. So I think, and probably getting lots of word of mouth referrals now. That's been great. So really building on my client list, and that's going to follow through to my partner and our employees.
What would you say to other physios out there that are considering RM or that are in that process of looking at RM at the moment?
I think you've got to approach it with an open mind. I think if you're really focused on getting results for your patients, getting them better in the fastest possible time, if you're interested in doing less for a bigger return, financially in terms of business and also in terms of outcomes for patients, I think it's a definite. It's something that will definitely help you achieve those things. So I can fully recommend it. But I think you've got to be ready within yourself to take that step, and it is a big step to take, not only clinically but professionally, and the way you look at how your practice runs, and also challenging beliefs about about money and about what you're worth and all those. So you do need to be able to confront those beliefs and challenge and be open to exploring what else is possible.
When you first heard about RM, was that through an advertisement or a letter? Or through a
I think it
friend?
was just word of mouth. I think it was the guys we saw on one of our business courses had just done it and had raved about it. So I thought, it's something I want to look at. Yeah, I think it's when you're looking at improving or you're looking at achieving excellence in a particular field, you've got to align yourself with, the best people in that field, to mentor you and guide you along, because nobody's got all the answers, So I think this whole approach allows us to align ourselves with a particular philosophy and a system that really works, and also, mentoring in Michael. I think, we're aligning ourselves with someone who's proven the system works. He's done it in his own business. And he's got a great business model and a great business sense as well. So it's something that we can learn from, and I think our business will only improve, and we'll only improve as clinicians as well from aligning ourselves with this approach. There was something about the higher fees. I really couldn't get the higher fees, and how he was able to charge so much higher but do the same thing. And I think I asked him, well, are you getting better results or something, to be able to charge those? And then that's what sort of opened the door for this whole approach, that it is different and it does get better results.
Is there anything else you'd like to share with other physios that may be considering doing RM?
Look, I think the first time I saw Michael present, I thought, this guy is onto something. I thought he was, a pioneer, leading the way. So
Yeah.
I think he's done a fantastic job with RM so far, and I can really see the potential in it. And I think this is going to be the way of the future. I think this approach positions us as real specialists and leaders in musculoskeletal health.
Excellent. Well, thanks for your time.
You're welcome.